Good evening. Wanted to do a quick walkthrough for week 7. I know it's a little bit late in the week, so we'll call this a check-in and just kind of review everything, make sure everybody understands what the expectations are, and if anybody has any questions, you know how to get a hold of me. This week we're talking about drug policy, criminalization, and public health, and looking in terms of what social or structural determinants of health um, can, I guess, lead people or leave the door open for people to go down this particular path. Um, and then what are some things that we can do? Are there any things that we are looking at that set one specific group, ethnicity, race, religion, etc., apart in terms of drug use, substance use, criminalization, those types of things? So we are on the week 7 homepage, and you again can see any of the announcements that are up there. And then everybody's pretty much been keeping up with the assignment, so I'm really happy about that. And the responses that you have been supplying have been well thought out and on topic, and showing a good handle on the concepts of the course. And so I'm happy about that. So let's talk a little bit about substance abuse and the concepts that we're going to talk about that are in your lesson for this week. So I'm sure you all are aware that substance abuse or substance use, there have been different terms that have been used. Substance use is the currently accepted term, is very complex, very multifaceted, many different layers, so many different drugs, reasons for using drugs, things that qualify as drugs, if you want to include tobacco, alcohol, can happen to babies in terms of moms that are on drugs. People can also have addictions to opioids. So many different developmental levels, socioeconomic levels, just rampant. And so looking at what are some of the real life consequences, and when somebody commits a crime, substance use as a crime, then what is the consequence of that? And is that, are we looking to punish people? Are we looking to, we or the government or the county, the society, looking to punish people or to perhaps rehabilitate them? So we're going to look at a couple different options there. And then are there disproportionately more people of color or from lower income communities that are incarcerated or have histories of substance use? And looking, like I said, at public frameworks, public health frameworks, and then comparing the different approaches. How can we look at this? How can we maybe prevent this from happening in the first place in a lot of cases? How can we turn things around and be a society of social justice and equity? So we're going to talk about some key concepts, and criminalization is one of them. So for this particular lesson, looking at drug use as a legal violation that could potentially lead to incarceration, being in jail. And then what is the public health approach? So there's something called harm reduction, which we'll talk about. Things that we can do in terms of educating the public to help with prevention, getting help, treatments, counseling, things like that to people, having people have access to all that, community-based solutions, things that you all are working on right now in your project. Talking about mass incarceration in terms of is there a disproportionate number of those in prison that are people of color, especially Black and Latinx individuals, for nonviolent drug offenses, which is what we would consider substance abuse, substance use. And then harm reduction. I don't know if you've heard of that term before, but I guess I would tend to think of it as what we used to call sort of rehabilitation, but it's evidence-based strategies that try to meet people where they are, aiming to reduce the negative consequences of substance use without requiring abstinence being non-use. So working with them trying to figure out, I think one of the big key things is when did it start? Why does it start? Why is the person using substances? And trying to decrease the use if possible, figure out ways to help them cope in ways other than substance use, that kind of thing. And then the readings are listed here. The National Harm Reduction Coalition tells you all about their program. And then some of the chapters from your the books and readings, and then your assignments this week. We can go ahead and take a look at those. Very similar case study analysis. You have done that before for the food desert or the food garden, and then researching a current public health issue. This one's just focusing on substance use, but let's take a look at those just to make sure that there's not any questions. So you're going to research a current public health issues related to drug use or criminalization using credible, as we've been doing throughout the course, credible information sources. And so the objective, this is the course objective that meets, and then this is the assignment. These are the assignment objectives. And so here's the overview. Choose an area, any one of these areas on which to focus. And it's like I was saying before, it's multifaceted. Substance use is multifaceted. It's not only medical, mental health, there's social, racial, economic inequities that are present in this. And so that's what you're going to learn about and then talk about. So choose a topic related to substance use and justice. See the topics from above. Research the issue using at least 2 credible sources, public health academic sources, and then a short report paper that addresses and answers these questions. So what's the issue? Why is it a public health concern? Who's most impacted? What disparities are present? How has criminalization, again, one of our terms, how has that affected the health outcomes, treatment access, or community wellness? Are there any solutions? Do you foresee any solutions? What have you seen in your neighborhoods? Any reforms that are being proposed and or implemented? And what role should health professionals or public health advocates, that's you all, public health advocates, what role should we play in this system? So here's the format. You can do whatever works best for you as long as you answer all these questions, worth 15 points. So there's that. And then let's go back to, so again, very similar to that first one, and people did a nice job with the first one, so I expect that y'all will do a nice job with the second one as well. And then the case study analysis, this one is called Prescription for Prison, Darnell's story. So his story is here, and so you're going to look at the case study. It relates to health, social justice, it relates to substance use, as well as criminal acts and incarceration. So it's trying to pull the concepts together. And so you want to respond to the following prompts. You have some questions there, 5 questions, and include at least 2 credible resources in your answering of the prompts. And so, you know, what public health, safety, social justice issues are present in the case? Read the case. What do you see? These are some examples that you might see in there. Do you feel, how did trauma, unmet health needs, and systemic failure, those structural determinants of health, how might those have contributed to Darnell's violent behavior? What public health strategies, trauma-informed care, that's very prevalent right now, restorative justice, harm reduction, the things that are in your lesson, and we just talked about harm reduction. Could those strategies address both his needs and community safety? What do you think about that based on the case study information? Are there any changes that would you recommend to justice, healthcare, housing systems to better support people like Darnell? And I like when students think out of the box or think, you know, are not restricted by, well, I'd like to do this, but I don't have the money, or we don't have this in my community. That's okay. Just think out of the box. What are, you know, what are some solutions? What are things that we need to be doing to help people and help our communities? And then what role can public health professionals, community organizers, policymakers, public health advocates, you know, what role can we play in creating safer, healthier alternatives to incarceration? Does putting somebody in jail and prison, does that really serve a purpose? Does it help? I'm not coming down one way or the other. I'm just asking the question. And what are alternatives? What are ways that we can help people? And there are some evidence-based, credible resources and studies and projects out there that have worked. So that is your work to figure out. And then you have your rubric. And then we'll go back and look at for your journal, which I have been looking at, haven't been grading, but I have been reading. So most people will get the points at the end of the course, and I do apologize for that. Again, make sure that you're adding in links and pictures, things to make it memorable, kind of like a study guide or resource. It and your capstone project are taking the place of a final exam and quizzes as well. So that's what the journal's taking the place of. So thought and effort is much appreciated in your journal. So the reflection questions that you had, what are public health consequences of treating substance use as a criminal issue? That is very similar to the prompt. It's just a rewording of the same prompt that you had. And then in what ways do harm reduction strategies challenge traditional narratives about drug use? So if we're using harm reduction strategies, how does that you might ask parents, brothers, sisters, aunts, uncles, grandparents, traditional narratives about drug use. Again, that is a rewording of the same prompts. So those are the same basic questions that you have already. And then I added a third one. What are the ethical considerations of withholding healthcare, housing, or employment from people who use drugs? Because there is a stigma associated with that, and then that becomes a social determinant of health issue, as well as probably structural. And what are your thoughts about that? So please add that to your journal. So we covered the assignments, we covered the readings, the key concepts. So let us go look at the lesson, and I'll kind of go through that a little bit for you. And let me go to the move that, view a student. And we are in week 7. So just to make sure, yep, those are the things. There's your capstone. We'll take a look at that at the end just to double check. So let's take a look at the lesson. So again, I have some tabs here for you to kind of break the information out into smaller chunks of information. You just click on the tab and it will give you the information. So in the overview, this is basically giving you the objectives, things that we'll be looking at, the lesson objectives, and what ways, are you able to meet these? Can you answer these questions after studying this particular lesson? And also, I continue, unfortunately, to use the term drug abuse, substance abuse. Those were older terms, but then I gave you a little history here just to understand where we are now, and we are on the current term, substance use. So just so you're aware of that. And then there's historical context. What is this a new problem? Is substance use, is that something new? Have we had this historically throughout history? What's up with that? So I just wanted to give you, it's sort of a long a lot of information because we are going back into the BC times, ancient opium use. That's one of the examples that I've presented here for you. And everybody was using opium. You felt good. They had opium dens. Everybody went and took their friends, and then it just kind of walks you through history that we've always had it. When Christopher Columbus came and everybody came over to the New World, they brought tobacco, alcohol with them, and other substances as well. And we even had wars. We fought wars over things like opium, and that would be a global health issue. In the United States, we did have different laws that were enacted to kind of help curtail that. as well as those who would be not just the people using the drugs, but people that were manufacturing, selling the drugs, putting them out there. And so the Harrison Narcotics Act of 1914 is an example of that, a federal, so across the country, federal law to regulate and tax production, importing, and distributing opiates and coca products being cocaine, which was originally what was found in Coca-Cola, which is kind of interesting. So this, again, kind of gives you some information about that. This talks about race and criminalization of drugs. She has a good little, some good information there. 1937 Marijuana Tax Act. So tax on marijuana back in 1937. Wow. And so it was tied, and some of this information that's given here will show you how it was tied to anti-Mexican, Hispanic, anti-Black sentiment, and supporting the Caucasian point of view. And so ethnicity in marijuana, how does that, where does that come from? Here's these little stamps here that talk about the tax. And then this is actually a podcast. You can click on that. It's a 16-minute podcast from Newsbeat, The War on Drugs, and talking about how President Nixon in the 1970s, 1971, declared war on drugs. The person who came after him, Gerald Ford, Nancy Reagan, people in the 70s and 80s, just say no to drugs. It was just say no. That was the campaign slogans, just say no. So there's that. And then crack versus cocaine sentencing. I think, I want to say in the Hunter Biden interview that just took place, I think this last week, that he actually describes the difference. So I'm sure you can find that someplace. But there are different formats of drugs, not just cocaine. But is one way, if you are selling or using one particular form, is that carry a higher jail sentence, for example. And so looking at racial disparities in incarceration and calling for reforms. So civil rights and social justice groups calling for reforms. Again, different crack cocaine, powdered cocaine, showing you the different trafficking offenders. And then in 2000 is when harm reduction strategies emerged. We talked about what harm reduction was. So that really started around the 2000s. So that's been what, maybe 25, we're in 2025, so about 25 years. And so things like needle exchanges and naloxone access. Needle exchanges we actually talked about in the 80s with HIV and AIDS because of sharing needles. We realized that it was a sexually transmitted disease, but it wasn't just sexual transmission, it was blood and body fluids. And so IV drug use was the other big population of people who were contracting HIV and AIDS. And so needle exchanges, naloxone. I have naloxone in my car. My husband has naloxone in case they need it at the bar. He hangs out with his friends. And so just some different information. SAMHSA, substance abuse. They still call that substance abuse and mental health services administration. And just giving you different ideas of what different different frameworks might be, different social service programs that might be available. When you talk about a needle exchange program, you'd bring your dirty needles that you had used and you would be given clean needles in exchange for returning your dirty needles because people share needles and that's a problem, safety problem. And so the public will say, well, why are you doing that? Just take the needles, don't give them new needles. Well, it's a person who's withdrawing from drugs that can become a medical emergency. So we need to do more than that. This at least is keeping them hopefully safe and from getting infection like HIV or like tetanus, something like that, that's going to be really dangerous for them. And then when we get them, hopefully when they come to the needle exchange, we can get some information and then maybe be able to work with them in counseling or do some other things maybe to help them no longer use substances. Oh, yeah, hepatitis C. That's now. I mean, HIV is still around. Hepatitis C is now very common as well. And so the public health framework, this approach focuses on preventing drug-related harms, right? So we're trying to prevent problems from happening as a result. We're noticing that, okay, this is an issue. We can't just say, no, it's not an issue or sweep it under the carpet. We have to deal with it. So as public health advocates, what can we do to keep people as safe as possible and get them help as well? So there's information there. And then 2012, legal cannabis begins in Colorado and Washington. Those were the first two states, gives you a little history there, shows you in what states marijuana is legalized these days, gives you that information. And now bringing us up to 2020, fentanyl. We hear a lot about fentanyl and drugs coming over the border. And so it's a business. It's a big business. And so we also have the opioid crisis. So there was a point in time years back, I can give you my example working in maternal child health, labor and delivery, postpartum. We used to give opioids all the time to postpartum moms, whether they delivered vaginally or C-section. So whether it was a natural childbirth or medicated or a C-section, which is a surgery. And no matter which type, you would be given Percocet, Percodan, a lot of good medications. And what happened is then people became addicted to those. I've talked to colleagues, I have friends who will say, oh, my mom went in for hip surgery, for example, never really touched opioids at all, but was given an opioid post-op to keep the pain in check and could never get off the opioids, became addicted. And so these are our modern day struggles. And so there was a spike in deaths. What happened during COVID-19? It actually exacerbated pandemic and restrictions exacerbated the crisis. So it was harder for individuals with substance use disorders to access treatment and support services because everything shut down. And so the monthly deaths, the overdose deaths spiked, which is really sad. And so there's a couple little videos there for you about the fentanyl crisis. And we'll go back up. So you really can see that this has always been a problem, and we've tried different ways of solving it and helping people throughout the ages. If we move on to why people use drugs, so many different things, reasons why people might use drugs. It could be survival, coping. This part talks about social determinants, structural determinants, and health inequities in terms of understanding that it doesn't happen like in this little vacuum. It's misunderstood in terms of it's the individual who's using the substance is a bad person. They have problems and it's a moral failure. And it's as we started out, it's multifaceted, multi-layered. And so a lot of different reasons that people turn to substance use. And so some of those reasons can be rooted in social and structural determinants of health. Upstream factors, things that we talk about upstream. So not in terms of the individual, things that happen before it gets to the individual. So that's an upstream factor. So that would be considered a root cause of health and behavior. So things that happen before someone even ever takes a drug. Here's about a drug, and so that could be social or structural determinants of health. So you have a couple tables in here that show you how social determinants, in what ways they could potentially contribute to drug use. So looking in terms of social justice and inequities, if you look at poverty, you look at race discrimination, unemployment is a problem, not having housing stability, mental health, lack of access of care, community violence, neighborhood and built environment, or community and social structures. How are those things moving people towards substance use? So chronic stress, not having basic needs met, right? Go back to Maslow. The basic needs are not being met. Systemic barriers, generational trauma leading to depression and hopelessness, loss of identity, living in shelters or on the street or unsafe housing that increases exposure to the behavior, mental health, anxiety, depression brought on by many of these other factors. It's kind of like this big circle. I try to do this and this I can't, and then I just keep going back and just gets worse and worse. People self-medicate for physical or emotional pain if they can't get to a doctor or if they don't have insurance. And then violence and grief can lead people to substance use. And then, so we can see where social determinants might be a factor. But what about structural determinants? How might they influence substance use? And I hadn't really thought about that till I was putting the lesson together. I'm like, yeah, I guess there are a lot of different structural determinants that could potentially do that. So we're talking about right now, the criminal justice policy, right? Harsh sentencing laws punish people for drug use without offering treatment, right? That's not really helping anything. That's punishment. And then when you have a criminal record, it's harder to get a job. It's harder to get housing, which just then becomes a downward spiral. Housing policies, lack of affordable housing or shelters. And so then you're in you might be unhoused in an unsafe living situation, increases stress. Again, some of these are social determinants, but from a policy perspective, then makes it a structural determinant. Economic policy, low minimum wage jobs, immigration policies, those are right on the forefront these days. Fear of deportation, exclusion from public services. Then people don't want to get help. They don't want to find help. But in addition, that social and structural determinants can also help to alleviate substance abuse. So just as they could be potential causes of it, they can also help to prevent or alleviate it. So if we turn those things around, then that would help to decrease the stress and people would have homes. They would have stable housing and access to education and community support and economic stability. Access to healthcare and safe neighborhoods. And then by putting harm reduction policies into action, universal healthcare access, education policies, housing initiatives, the policy pieces of those social determinants that decriminalization, diversion programs, those things can help to alleviate or prevent substance use. And then also understanding that there are systems of inequality. That's one of the big themes throughout this course is inequality, inequities. So certain groups are more likely to face the upstream conditions that contribute to drug use. And it's not accidental. It's a result of structural inequality, which might include, again, going back to some of the things that we just mentioned, housing discrimination. There's an overrepresentation of BIPOC people in high-risk neighborhoods, underfunded schools and health services in poor communities, criminalization of drug use in Black and Latinx communities versus medical treatment in white, wealthier communities, gender-based violence leading to higher substance use in women with trauma histories. I will say that drug use is not solely specific to lower income or BIPOC communities, that there is also drug use in middle class as well, and wealthy populations. It is in every population. And I've not done studies. I should probably look that up. But there was a lot of stress. Some of these the housing is not unstable. I would say it's probably more stress, or you're running the business actually end of it. But these are the inequities, and the people on the other side, the people that are stressed but have $1 million houses, they can afford to stay out of jail, or they can afford to seek treatment, or to make sure that the drugs that they are receiving are in a pure form and not tainted with anything, so they're safer. So it's just interesting to think about those kind of things. And the systems of inequality and structural determinants are not really the same thing. This sort of gives you an idea of what the difference between those two ideas are. And then these are just questions to ask yourself. What factors increase someone's risk for substance abuse? This might help you in doing your assignments for the week. What does it mean to apply a social justice lens to substance abuse? That's when we say, well, what things what systemic things are the problem instead of saying what's wrong with the person, right? What systems or conditions have failed the person or the community is another way to look at that. And how we reframe it, how we talk about that. And then, here's a question. When we blame individuals for the drug use, we ignore the systems. How do you agree? Do you agree? I mean, how would you answer that? You agree or disagree? So these are just two random answers of supporting it or agreeing with it or disagreeing with it. But you can come up with your own. What do you think about that? And there's a couple of videos there to watch. So many reasons, right? Many reasons why people use substances, abuse substances. So we've got this long history. We have why are people using, and then what happens now when people use? Now we're going to bring in the criminalization, mass incarceration piece of it, and the health inequities, and how drug policy creates health disparities. Now we've already sort of touched on this in the previous pages that we've looked at, but this just goes into a little more in depth into specific criminalization. So arrest, harsh sentencing laws, maybe surveillance, setting up, police setting up sting operations, and instead of instead of trying to figure out why the person is using drugs, it's that we're punishing the behavior without treatment or support. And a lot of that depends on funding. There are, rehab facilities. There are county mental health resources available. But it just seems like, well, we're just going to punish everybody. That's an overgeneralization, but that's sort of the lens that we're looking at if we're looking at in terms of social justice. So mass incarceration, right? Large scale imprisonment of people in the US, especially Black, Latinx, and Indigenous individuals. The war on drugs in the 70s and 80s, like we talked about, fueled this and imprisonment and the policies that came into place, and harsher penalties, targeted street level drug use, expanded policies in urban neighborhoods while ignoring the wealthier white Caucasian areas. And so the statistic today, 1 in 5 people in US prisons is incarcerated for a drug-related offense, which is generally considered to be a nonviolent offense. Black Americans are nearly 6 times more likely to be in prison for drug use than white Americans, despite similar usage rates. So remember I was talking about the Caucasian person who's kind of stressed versus the Hispanic or Black American. Similar usage rates, but the Black and Latinx people are the ones that are ending up in jail. So inequitable, yes, definitely. It's criminalization is not applied equally. Gives you some statistics there. And then how does that create health disparities? Well, I don't want to say obvious, but we've kind of been talking about that as well. So there's health risks. There are, once the person has completed their sentence, they're going back out into the community. There can be, now they have a criminal record, they've served time. It can be difficult to get basic needs met. Can also destabilize neighborhoods. Public resources go to the policing instead of the prevention or the care. That's a problem. Michelle Alexander does a nice job in this TEDx talk. If you're not familiar with Jim Crow laws, I would say go ahead and look that up. Basically, laws that supported putting Black Americans in jail, like Black Americans had no rights at all. And so that's her talk is, does that still exist nowadays? And then this is a PBS prison state talking about criminalization for substance abuse, those charged with substance abuse. And then again, just some questions to think about. How does criminalization of substance use contribute to health inequities? We kind of answered that, but what do you think, or what have you seen? What have you experienced? Who's most impacted in terms of, we had said Black Americans, Latinx, their families, but who benefits? You have to think about also who benefits from this system, because somebody's out there making the drugs, selling the drugs, getting new people hooked on the drugs. And so what's who's benefiting from this. And so why does it continue to happen? Why aren't we going after those people, the suppliers? Maybe we are, but the suppliers, the cartels, those kind of things. So this gives you the most impacted, who pays the price, but what about who benefits? And we talk about, I give you the example here in this lesson page about war, right? When we're fighting a war, we have the war in Ukraine right now, Ukraine and Russia. And why are we still in it? Why hasn't it stopped? People benefit from war as well, from making weapons and all different kinds of things. Somebody's benefiting, which is why people don't like to end wars. They like to keep them going, which is a shame. And so I tried to liken the war, if you will, war on drugs, the drug wars, to that. And so who benefits, right? Political leaders and institutions might benefit, private industries and contractors, right? Those people who would be making the drugs, media outlets, they might. They do a lot of reporting, and they can, I don't want to say spin, they can promote certain ideas certain ways by giving one side of the argument instead of both sides of the argument, and get people to fall in line with them as well as systems of power. Those are other things, keeping the public focused on the punishment. Then the people in power avoid having to invest in structural solutions. We blame it on the person instead of the system, and the system doesn't have to do anything about it. And so then these are specific war on drugs examples. And that just goes into more detail there. And so what would happen? What could happen if we redirect resources? What are the possibilities? What could happen, right? If we redirected funding from these war-based approaches towards healing and equity, we could expand affordable housing, fund schools and healthcare clinics. People mention in my growth and development class, but also in your class as well, mobile health clinics. How nice would it be to have multiple mobile health clinics in the area to help people? I think that would just be amazing. Creating safe, stable environments, treating substance use as a public health issue so that care is offered with dignity and respect. And I think that would be absolutely amazing. And so how do we get there? How do we do that? How do we accomplish that? And so that's what this public approach, the last piece of the lesson. So 4 pieces of the lesson: the history of it, why people use drugs, leading into the criminalization, but what can we do using a public health approach? Again, this might be something that you're looking at in your capstone project for the course. What public health responses, we learned in week 6 as well, prevention, right? So the more we educate, community programs, early intervention, drug programs in middle schools, things like that can be very helpful. Access to care, right? Harm reduction policies, we just talked about that. Policy changes, the structural systemic barriers is another thing that we can address as public health advocates. So looking at those different types of things, what contributes to the problem, and then is there anything we can fix or suggest? And so again, not asking why did the person do it, or why did they make the bad choice, but what systems or conditions led to that particular situation. And so if we look at those key questions, what are the problems, right? Lack of mental health services, systemic racism and poverty, unemployment, the chronic stress, I don't have a house, being houseless. And then what upstream changes could we look at? Things through, policy. So housing initiatives, universal access to healthcare, trauma-informed schools and workplaces, and decriminalization and diversion programs. So that would help redirect people from jail into health services and hopefully reducing the long-term harm. And then how can we build a supportive environment, right? How can we be supportive in helping people instead of punishing, coming from that punishment type of viewpoint? And so we talked about harm reduction. This particular lesson page goes specifically into harm reduction and that program, that theory. And then community-led initiatives, policies that prioritize care over punishment, and then we go into the harm reduction. So there are studies to show the failure of punishment first approaches, that just didn't work. The numbers didn't come down. It was still a problem. And then we shifted to harm reduction. It says here the 1980s. We said in the previous lesson, two lessons ago, or lesson pages ago, the 2000s. So, but it really, but I did mention in the 80s about the needle exchange programs with HIV and AIDS. So that's where that's coming from. And I think this is a really key point here, recognition that people who were using substances, but weren't ready or able to quit, they still deserve support and safety. And so I think that's a big key piece that we missed, that we could be taking advantage of and helping, and we're just letting it slide. And then it gives you some examples here, other countries that are implementing harm reduction programs, and they're widely recognized as evidence-based practice, cost-effective, and ethical strategies to help prevent substance use. And so do they work? Yes, these are some statistics, some reasons that they do work, examples. And, are they everywhere? Unfortunately, no. Could they be a lot more places? Yes, that's why we're learning about them in this class. Some of the big cities do, but what about rural areas? Rural areas don't even have healthcare. So why would we expect them to have harm reduction programs? But it's a possibility. We could do like telehealth, something like that. And then I think this is another good point. Harm reduction is more accepted for opioids, like pain medications, than for methamphetamine or cocaine, for that matter. And so the harm reduction services rely on nonprofits and grassroots. So the funding runs out. And here's some examples for you of different tools that are used: syringe exchange programs, naloxone distribution, safe consumption sites, supervised injection facilities. Gives you some example there, some fentanyl test strips, which is good, and then peer support and outreach. And so the question then would be, do we have these programs in Monterey County or Salinas? Well, yes, as a matter of fact, we do have some of these. And so then this gives you some local harm reduction and public health initiatives that are available, gives you some links to look at those, even in the school, Salinas Union High School District, and provides education as well, which we already said was a key thing. And then advocacy. Right? We've talked about advocacy throughout the whole course, right? And how do we make a change? So here are some ideas. Here's that community organizing piece that we're talking about in your project as well. Public awareness and education, and policies, writing policies. That's why we wrote a letter to a congressperson or a senator or one of our representatives to be able to articulate our thoughts and ideas and make a difference, make a change. And so again, some more key questions, things that you could ask yourself. And then, what strategies, I think in Monterey County, these ones might be very useful, but that would be up to you to decide for yourself. And then the last part of the lesson is the wrap up, just kind of brings it back around, things that we explored, and the bottom line. And the question is, what would it take to create a system that supports health, safety, and equity for all? Right? That's one of the key points of this whole course. I'll stop sharing. And we are just about done with our time here. Let me look at for your sorry, let me look on my other screen here. Probably because that's, oops, to get out of the student view, that would help. Leave my student view. There we go. Hopefully people are doing well. You're kind of a quiet group. I don't hear too often from you, but I am available. You can always message me on Google Chat if you have questions and or want me to take a look at something or check out your idea. And let's see, I should put that. One moment, please. All the way down. There we go. So your advocacy capstone project, right? Paper presentation or a advocacy package. Remember, this is worth 100 points. So this is kind of consider it your final exam. And include what's the issue, the strategy, your role, what you plan, any barriers you might face. What is the call to action? What is it that you want people to do? And make sure you include 3 credible sources. And then there's ideas for topics and the rubric. So please reach out. You can, I will go back to the discussion and respond to the people that replied later than others. The peers, you guys have been doing a great job supporting each other and giving each other great references and ideas. It's been really nice to watch. So I appreciate you're helping each other, which is another whole point of the course. So I will go ahead and post this, and I hope you all have a nice rest of your week, one more week after this. And I'm really excited to look at your capstones. So have a great evening.